Hello and welcome. Today I'm going to be talking to you about the effect of a low FODMAP diet with and without gluten on irritable bowel syndrome, which was a double-blind, placebo-controlled, randomized clinical trial. A bit of a background. Irritable bowel syndrome is one of the most prevalent gastrointestinal conditions globally, with 5 to 11% prevalence. We're going to see it a lot in clinic. Basically, what the current protocol is a low FODMAP diet, which is low in fermentable oligosaccharides, disaccharides, monosaccharides, and polyols, which is shown to improve symptoms by up to 70%. Something that's not yet been clarified is which constituent of wheat is actually contributing to symptoms, whether it's the fructans or gluten. So this double-blind controlled randomized clinical trial aims to assess the effect of a low FODMAP diet with and without gluten on patients with IBS symptoms. They used 63 subjects from 2 gastroenterology clinics in Iran that were diagnosed with symptoms of IBS. Participants were between the ages of 18 and 65. With a BMI of 18.5 to 25. They had IBS symptoms for more than 6 months, and those symptoms were classified as per the Rome 5 criteria, Rome 6 criteria. The inclusion criteria included no history of things like small bowel, colonic gastric operations, diagnosis of organic intestinal illnesses based on the colonoscopy over the past 5 years, and intestinal infection. Exclusions included gastrointestinal medications, pregnancy, athletes, breastfeeding, artificial sweetener use, diet specifics, and the lack of desire to adhere to the protocol. The study, so participants completed 2 different questionnaires, one which was on the quality of life and the severity scoring system of those with IBS. And the sum of those 2 scores indicated the severity of disease for them. The study aimed to, the primary outcome for the study was a significant reduction in the IBS severity scoring system, which is IBS SSS. And secondary outcomes were a change in IBS symptoms, which quite extensive. We'll see that in the in that first slide there with the table 1, and also their quality of life. The results of this study showed that the placebo group had a greater improvement on a low FODMAP diet without gluten 6 weeks after the treatment, opposed to the intervention group that had gluten included in their diet. There was a mean difference of IBS SSS of 17% with a p-value of 0.91, the gluten versus placebo group. The effect estimate was not reported, so that was calculated externally. Because it wasn't reported, there was no 95% confidence interval reported for the effect estimate either. The effect of the low FODMAP diet with gluten was not statistically significant compared to a low FODMAP diet with gluten. And although the study shows that eliminating the FODMAPs from the diet with the addition of gluten doesn't affect the IBS symptoms except in around 20% of patients. And that's in line with prior evidence and research that's been done as well. Critically appraising the study, there's we couldn't really tell if there was allocation bias because the randomization process wasn't noted. Attrition bias was a risk due to the differential dropout, although the power remained at 80% of the study. Performance bias was not determinable either because there was no specific information noted about the blinding of the participants and the investigators. And reporting bias was present due to the effect estimate and confidence intervals information missing. Clinical recommendations from this study for our clinical practice shows that eliminating the FODMAPs from the diet in addition to of gluten-containing foods affects the symptoms of IBS in around 20% of participants only. It appears to confirm previous research that non-celiac gluten sensitivity may exist in this 20% of people that are showing those symptoms. So clients that have self-diagnosed non-celiac gluten sensitivity are likely to present at our clinics with symptoms of IBS, but their symptoms might still be persisting due to the non-gluten containing FODMAPs that are still present in their diet. So a low FODMAP diet with gluten might be suitable for people that don't have gluten sensitivity or celiac disease, while other clients might respond well to a gluten containing FODMAP diet. Sorry. Well, the other clients might respond better to a non-gluten containing FODMAP diet. Further investigations are recommended to investigate whether fructans are actually the main contributing factor to the IBS symptoms of IBS. Thank you very much.